difficulties often refer to difficult behavior. So when providers see a patient who exhibits some so-called difficult behavior, like demanding, being maybe verbally aggressive, being rude, those are often termed as so-called difficult patients in the literature. Difficulty, often it's again located in the patient's behavior, but how the provider knows that there is difficulty is because they have some uncomfortable feelings when they see particular patient. And so these uncomfortable feelings could be part of what we call countertransference reaction. Countertransference defined in a very large, in a kind of a broad concept, means any reaction that a provider can have to a patient. More narrowly defined would be reaction that it actually has to do with the provider, with the provider's subjectivity. Patient may remind provider about somebody from their past. So then provider could react in a particular way. And then sometimes it is really the patient's behavior that creates the reaction. So it could be one of those things. So the first thing that you do is really be able to stop and be aware of your feelings. So awareness is the first thing. Acknowledge those feelings. Understand that any kind of feelings are okay. It's okay to have feelings. It's really more what you do about these feelings that matter. And sometimes the difficulties exist because as providers, we think we shouldn't have certain feelings. Again, there are so many these possible difficult interactions that there are many different tips depending on particular kind of difficulty. But very, very general tips would be that provider needs to be able to be aware of existence of these feelings, acknowledge them, as I mentioned before. I actually try to put these tips into kind of ABC format so that they're easier to remember. So first would be A, be aware of the feelings, acknowledge the feelings. Then B would be set some boundaries. Also would be just take a deep breath. Don't react, be able to step back from your feelings. C would be just be able to share some control with the patient. So think of your patient as your partner and see how you could involve the patient as a partner in decision making. And then D would be determine the meaning. Why is this particular patient reacting this particular way? Because there is a reason for that kind of reaction. Because people don't react certain way just to be difficult. So we need to understand what is behind that reaction, and then it may be easier for us to help them and be easier for us to get to the step B, which is E, be able to empathize with the patient. And E also would be for just extending the system. Don't think, as a provider, don't think of yourself as you are all alone to take care of this particular patient. So talk with your colleagues, send the patient for consultation. That would be that.